And then traditionally, there have been concerns with bortezomib about neuropathy and neurotoxicity, and that's particularly been the case when considered twice a week injections, intravenous injections, and we've seen with more recent administrations subcutaneously and given weekly or every 2 weeks that these side effects can be really manageable. We know that you can select patients more carefully, so those with pre-existing neuropathy, you may want to dose reduce the therapy, or you may want to just closely monitor these patients. And we've seen in the 16 patients, all the neuropathy cases were grade 1 or 2, and there's no one with grade 3 or 4. Other side effects are quite tolerable, I think. So cytopenias, so neutropenia or thrombocytopenia can be monitored and managed, and we didn't have any major signals of any other significant toxicities, including infection. And certainly in this 16 patient series, there were no cessations due to toxicity of bortezomib.